What data, metrics, or case studies should resources be providing to prove the effectiveness of your solution?
So I'll throw out, because I've had this conversation with a number of people. In, in the absence of data, hard data that demonstrates exactly what it is you're trying to do a survey. Do survey data. It might not be statistically significant, but ask the end users how they respond to what it is you're putting out there. The old commercial about 3 out of 4 dentists recommend the use of Crest. Well, in that same sort of survey, 3 out of 4 murderers who are incarcerated use Crest toothpaste in the jails also. But the point is, though, it gives some sort of data substance to what it is you're representing. Next step would be to actually do some type of statistical analysis on the outcomes and use that. I've talked to a couple of clients about affiliating with a local university that has a statistics department and see if we could get a third party to independently evaluate the data and then use that as the basis for putting something out in the public. Beyond that, everything always falls back to the actuaries and becomes part of this actuarial science or mumbo jumbo.
I think it depends.
I mean, what would you guys see?
I mean, I think it depends on your product. For us, we're outsourcing MSO services to India and the Philippines, and we know very directly that they're going to lower their costs by about 60% by augmenting their staffing with our services. So it's very easy. They know they're paying a nurse $180,000 with benefits and everything else in the United States, and we're going to lower that by 60%. And so for us, it's really easy. What you got to be concerned with being on the health plan side is all these people that are going to say they're going to lower your overall medical costs. And there's so many things that are impacting lowering medical costs that it's hard to just pinpoint it to one product or one intervention, and those are the types of things you need to stay away from. But for us, it's very easy. I mean, we have case studies on our website of you're going to lower your administrative costs by 60%. You're going to have more money for medical services rather than admin services. So with our product, it's simple.
Yeah, for Command, the case studies and the data are really how we sell our product. I know Barry, as a client for many years, we would build a case for something, and knowing that all of our clients really struggled with, for the most part, the same issues, to be able to share it in a case study would really be the way we could show them how we could help them. I know, Barry, we talked about return mail with one client, and once we illustrated the savings, it became a very easy discussion for another client because they had the same exact problem. So yeah, case studies and like metrics to support it has always been for us like a really valuable way to do it. The hard part is, I always feel like you have to present it very clearly and really get to the core of the problem. If it's just a case study, that's almost like a marketing tool. I always feel like it's not going to capture anybody. It has to be directed very specifically at a problem that you solved in somewhat of a simple way, so you can really get right to the core of it. But yeah, I love case studies for us.
Barry, I would say your suggestion of using a survey would be a last resort. Because I think everybody that gets a survey or a vendor telling them about a survey is very skeptical, and okay, it's a nice discussion item, but I don't know how many people actually believe every survey that they have or every consumer rating that a vendor puts in front of them.
Well, what would you recommend then to a new entrant into the field who doesn't have the data to substantiate what it is? They believe it, they've done some thought around it, they don't have anything to offer up. What would you recommend in a case like that?
Questionable whether you're putting the cart before the horse. Maybe you shouldn't be out there until you have a proven model, and your model you must have some proof of concept before you went into the market. So you have to have something to put out in front of a potential client. So, but those types of things I think are much better than their survey or customer satisfaction and things like that.
Well, and maybe in that scenario, that's where a vendor would partner with someone that has the experience specific to that service offering, right? So that they can add to, their credibility.
You need a consultant.
Yes. Absolutely.
I'm gonna attempt to connect a few dots floating around in my mind right now. To Barry's question just now, and Kurt and Faith's comments, one thing, and this goes back to a question that we talked about earlier about how to identify our line of product to cater towards many different lines of products from the health plans, whether it be from a Medicare Advantage side and all of the possibilities of products that reside within that, and then Medicaid, commercial, stuff of that nature. I think from a marketing standpoint, it's very important to understand how your products can morph into all of those lines of business on behalf of the health plan, so that you can be able to cater those data and metric points to help them see the real value in your product. Case example for me, like as Justin explained earlier, here at Evolve, we focus on the accessibility and the safety of somebody's house. So we're performing construction services in their home, as opposed to like a traditional medical service for an individual. And when I think about it from a different lines of product standpoint, the one metric that comes to my mind that we use oftentimes in our sales approach is actually related to ER admissions, as Barry had mentioned earlier. I think it was in 2020 or 2019, according to the CDC, the average cost for an ER visit was $17,000. But that year, the average cost for a home modification from us was about $3,700. So if we're able to install a wheelchair ramp and a couple grab bars inside of a member's homes, how many of those ER admissions can we help reduce, which ultimately builds up that bottom line for the health plan? I guess it kind of goes back to a few discussion points ago that we were talking about, is really understanding how our product can be diversified into all of these different lines of business for the plan to help drive that ROI, and then translate that to a data. Apparently Siri wanted to get in on the conversation. And then drive that to help them make that decision. Getting back to the initial question specifically to prove our effectiveness, one thing that we actually have great success with, and it's actually a very vulnerable approach, is to show our partners where we're deficient and areas that we are lacking in and that we need improvement on. And that alone has presented many opportunities for us to have those partnership type conversations with the plan that Barry, you were kind of poking at in the previous question. And so being able to be vulnerable and to receive that criticism from our partners, I think is very important, to not only be humble enough to receive instruction, but also to be critical enough to give the instruction, because it's a two-way street. Like there's areas that my partners can improve on that we see, and there's areas that I can improve on that they see. But if I'm not willing to receive their criticism, why would they receive mine? And so I need to be able to be vulnerable and be teachable in those instances to get them to also listen to me in those times of correction when I feel like the criticism is justified, to be able to, I guess, put the ball back in their court. So I think from a data and metrics standpoint, like having that vulnerability and being willing to pull those skeletons out of my closet and show it to them and say, look, these are areas that we need help in. What are your thoughts on this? How do you think that we could improve this for overall member satisfaction is very important.